Good morning, and I want to welcome the leadership of the Disabled American Veterans to the hearing today. We are honored to have you here. Congress relies on the DAV and your team of advocates in Washington to keep us apprised of how we're meeting the needs of veterans. I know that addressing toxic exposure in a comprehensive manner has been a long-standing issue for the DAV. It is a long-standing priority for me, too. Last year, I vowed to work across the aisle to deliver bipartisan, comprehensive toxic exposure reform. After consulting with the VA on a path forward and my friend, Ranking Member Jerry Moran, we have developed a three-phased approach for getting this done. That includes offering life-saving VA health care to more combat veterans, including those suffering from conditions caused by toxic exposures. It also includes improved training on toxic exposures for VA employees and more investments into research. And together, we continue to work closely with the VA to build upon their efforts to establish an improved presumption process that is more fair, more transparent, and more timely for our veterans. And the time has long passed for us to provide benefits to previous generations of toxic exposed veterans, including the establishment of new presumptions of service connection. We started this fight, and together we will finish it. I also want to thank the DAV for their input in support of my Bipartisan Service Members and Veterans Empowerment and Support Act, which would improve access to care and benefits for MST survivors, many of whom were wrongly denied. Ranking Member Moran and his team have been great partners on this bill, and I'm hopeful it will pass the Senate very soon. In addition, mental health and suicide prevention must remain a top priority. We need to expand mental health care access for more veterans and increase VA's capacity to meet those needs. This means strengthening the Veterans Crisis Line through the Bipartisan Reach for Veterans Act and making sure VA is well-resourced to provide both inpatient and outpatient mental health care, including the highly trained staff to deliver it, through the post-9/11 Veterans Mental Health Care Improvement Act, another top priority of mine. Commander Marshall and team, we obviously have a lot left to do, and your voice is invaluable as we prioritize our efforts. We want to thank you for your work that you do every single day on behalf of disabled veterans across this nation. And we stand by to hear your marching orders. I just want to close with one thing. I've always said in these sessions before, and I will say it again today, this committee takes its direction from the veteran service organizations and the people you represent. Your testimony here is very, very important as we schedule the remaining agenda in this Congress. And I appreciate you being here. And I also appreciate my friend Joe Parsetich, who happens to be watching this today from the great state of Montana. Thanks, gentlemen, ladies. With that, I'll turn it over to Chairman Takano for your opening remarks.